All right, let's go ahead and start on the work session. For Brittany, Medical Director, you folks got the floor.
Good morning, Commissioners. I'm going to start off. As requested, the Board wished to have the Medical Director come forward before the renewal of the contract for the coming year. By statute, both EMS and the Health Department require a licensed physician to oversee both areas. For EMS Department, all certified technicians require a Medical Director oversight to operate within their capacity of providership. The Medical Director oversees the education program in the EMS Department, as well as participates as the senior of the Quality Assurance and Quality Improvement Program mandated by the state statute for EMS. The Medical Director's authority is also utilized for the Kansas Board of Pharmacy as well as DEA. We have to have power of attorney to purchase those pharmaceuticals and DEA requirements. Further, just recently, in beginning July 1, the Medical Director updated contracts for fire departments in the county wanting to operate under the umbrella of the EMS protocol, medical protocol for first response. We were able to negotiate that agreement and have an equal rate across the board and have that continuity of care. The Medical Director for the Health Department side is on the advisory and oversight role. The position is required by Kansas state law when a health officer is not a physician and we have a population of under 100,000 people within the county. Unlike the staff that focuses on day-to-day, the Medical Director's role is more on the medical oversight, reviewing and advising on clinical protocols, procedures to ensure that they reflect current medical standards, evidence-based practices, and state and federal guidelines, provide medical guidance and background and backup support to clinical staff, including answering questions and offering consultation when complex medical sensitivity situations arise for a patient, serving the liaison between the health department and the local medical community if needed, doctor-to-doctor consultation and things of that nature. The Medical Director also is a clinical lab consultant to maintain and necessitate qualifications for the CLIA certification, which is clinical laboratory improvement amendments. So any sort of blood glucose and lab performance things that happen at the health department, we have to have CLIA waived certification level, so it has to oversee that as well. Provides medical provider to perform clinical services as needed. So the Medical Director's office provides a PA to our office to help with actually seeing well children and those type of clinics within our organization. And so the Medical Director plays a vital role, obviously, in the success of both health and EMS departments as well as first responder agencies within the county. And the current Medical Director that we have is meeting and continues to meet all of those. Dr. McBratney is here today in front of you. She has been the Medical Director since I've been with EMS, and that's going on 29 years. So
Yeah.
Been there a long time. I also have here today also to answer any questions that may how the Medical Director interacts is the Assistant Director Brian Bailey with EMS, Sarah Baudry, the Clinical Manager for the Health Department, as well as Chief Zimmelman, John Zimmelman with Tonganoxie City Fire Department, who also is the chairperson for the Leavenworth County Mutual Aid.
Yeah, that's right.
Represents all those first responder groups that we have engaged with in those contracts. So.
Very good. Okay, Commissioners, let the fun begin. Vanessa, you go first.
Oh, my.
Yes.
What'd I do?
You keep getting us in meetings, so go ahead.
I was wondering if you supported a masking order to around the 2020 timeframe for the county.
Yes, we followed the CDC guidelines.
And then, do you recommend individuals to get COVID shots and or boosters?
Well, you asking my opinion, or?
As a professional, in your professional capacity, do you recommend?
Yes. But I don't, that's not my role at the health
Could
department.
you, I
Okay.
know, could you put that mic a little bit closer? I'm an old guy. There you go. Thank you.
Yes, but am I going to ask this as a private physician or answer this as the health department director?
Well, I guess either would be fine with me. I'm not being too picky.
Well, in my practice, I recommend vaccinations.
Okay. If there was another similar situation, then you would most likely continue the same way and would suggest the county be under a mask order?
I would follow the CDC guidelines.
Okay, thank you.
Do you have any right now?
Not right now.
Mike?
I have a couple questions. Thank you for coming. I really appreciate it. I've been wanting to have an opportunity to visit with you on a few of these issues for a while. Could you talk about the township's requirements for having a medical director referring to the townships and what your role has been in getting the townships signed up and what you've done in relation to that?
Are you talking about fire?
No, that like the townships each wanting to have a medical director?
Oh, that is fire.
Yeah.
So they have to have a medical director to purchase, for one thing, for their license, and for one thing, for medications. And so we have met with them. EMS has met with them. In 1986, when I first came here, I did this as a volunteer. I taught classes. Now it's really done by EMS, and I sign off on them. I don't know if that answers your question. But
Well, when I met with all the chiefs,
Right.
and they had a discussion about the fact that I don't know if everybody was up on the requirements, but everybody was getting onto the same contract, that you kind of are standardizing that across the
right,
the county.
We did maybe 5 or 6 years ago go to per employee. This per is however many employees they had is how we just came up with the income.
Okay.
But now we just went to a standard cost for every facility.
And maybe the chief could adjust this. Are we kind of all caught up on most of the rural fire departments?
We had talked about that before, but
Yeah.
Dr. McBride met with us, Jamie met with us, and we came across, and it's a flat fee now. It's much more economical for all of us to come under this umbrella, but we are required by the State Board of EMS
Yep.
to have a medical director.
Yep.
Right.
She's been very receptive to that and came across with this contract that, I mean, again, this was much more
makes sense.
affordable for
Yeah.
all of us to have.
Yeah.
Because
Right.
some departments out there couldn't afford it.
Yeah.
And that's standardized across the county now.
Correct.
Everybody's contract is the same.
For everybody that wants to participate.
I was going to
Yeah.
say,
Right.
for all the departments that want to participate, there is the Fire District 2 has their own medical director. They've gone.
Yeah, that was my
with,
understanding.
and
But that was a good solution. I mean, we
Well,
all got
and
together.
our stance from
Yeah.
Mutual Aid Association and our stance from Tonganoxie is that if I put that patient in the back of Jamie's ambulance, we follow their medical protocols.
Right.
Well, we want to follow the same direction that everybody else does in the county so we can work together in a better, kind
Absolutely.
of a mutual aid aspect.
Gotcha.
Well, very good, because that was an issue that had come up, and I chatted with Jamie a couple times. We chatted, and I appreciate that that's been taken care of. As a medical director, just kind of letting us know, because I think the commissioners, it's taken me a while to understand that role. Can you tell me kind of what the state statute or what your understanding is the role of the health director as opposed to the on frontline people like Jamie? What is your role?
More advisory. I mean, what Jamie read is what I do.
And how does that work day to day? Like,
So the health department calls more often than EMS, but EMS I'm more available, or I do more education for EMS. So I'm physically there at least once a month, sometimes more often if there's a problem or an issue, or a celebration like a code save. I might go to that. Health department's more questions. We can't get this antibiotic to treat this. We can't get a hold of this patient. I've gotten phone calls, tiger bites, bear bites, bloody mattresses found on the side of the street, human waste on the side of the street. Police bring me bones. Is this animal or human? Does this have to go to the coroner? Can I exclude it's human? I mean, those are just. Those are just things that come up, maybe once a year, but I'm available when they do.
so on a monthly basis, what number of hours would you say you spend performing this role?
Well, our PA's, I think about 12 hours. I'm at least, I'd say 3 hours a month.
And does it kind of go in spurts? There'll be a
Oh,
lot
yes,
one
during
week and-
during COVID, I had
Oh, yeah.
thousands of phone calls from physicians. I mean, it runs in spurts. I mean,
So-
if we're out of an antibiotic, then I might get 7 or 8 phone calls in one, over a 2-3 day process to where we can get a different antibiotic, because the nurses are working under protocols. If the protocol can't be completed, I have to come in with a solution. So that, every patient, I get called every patient for that. And then when the antibiotic comes in, then we go back to our protocol. I may not get called again for a couple months.
So you brought up COVID. I don't really want to revisit that. That was a horrible time. But for commissioners too, because we didn't know what was happening, and you folks didn't know it was kind of a crazy time. But looking backwards towards that time, we had like monthly reports on how many cases of COVID there were in the county, how many cases of influenza. I remember that was the issue. Sometimes we said, well, this was the influenza number, and this is the COVID number, and now we don't seem to have any real good numbers on. I don't even know if they're keeping COVID and influenza really well by county anymore. Can you comment on that?
We still keep influenza and COVID numbers. They're just not reported. We don't individually report. As a physician, I don't have to report a COVID.
But it's not like on the state statistical, like I can't look it up.
Right.
Like,
I think last month we averaged about 360 deaths per week, but it fluctuates.
but it was so interesting during COVID, we were keeping this chart.
Right. But it's no longer, I mean, we don't, as a physician, in my practice, we don't have to report COVID numbers anymore.
Did you have something you wanted to add?
Wait, go ahead. Come on down.
I just wanted to say that KDHE does have a respiratory illness dashboard available. So that
Okay,
information.
maybe I just haven't been able to find it, or because I know we did talk about that the last time you were here.
Right.
Yeah.
But
About
again, that's a respiratory, that's not specific to just a COVID number. That is all inclusive. We're
Yeah.
talking about those numbers.
But that'd be also separate from influenza.
Influenza is included in those
So they
numbers. I'm not sure. They may
Influenza
have it.
illness.
They may have it broken down by influenza and other respiratory illnesses, but KDHE does track all those numbers by county level.
So that was some of our during that time. It was very difficult to. I mean, we were having people say, we don't have this many cases, so why should we put this regulation in effect? And it was really difficult to make those decisions. And we did try to follow the CDC, but then some of the CDC over time it changed.
Correct, as we knew more.
Yeah, and one of the things that never changed that I always thought the science was there was the fact that we were masking young children, because the incidence of COVID was lower among that group, and also when they did get COVID, it was not as severe. So the question on that was, is the masking going to cause more problems than if they got COVID? So do we have the latest science on the masking?
We did not believe that COVID masking increased patients' complications.
Well, say that again.
Wearing a mask didn't increase your complications.
Okay.
There's not been a study that showed that.
But whether it was necessary for young children, that was,
There's different opinions still. I mean, the studies aren't
do
complete.
you have an
complete.
opinion yourself?
You should have asked it right out, Mike. That's where you were going. Go ahead.
So my opinion is we don't know yet. I don't think it caused any harm.
So you think when we masked all the kids in the school, looking back, that we don't now know that's probably wasn't a good idea?
We don't know that yet.
So, All
We
right. So on the issue of vaccinations, same thing. The young kids get vaccinated, but yet when they did get COVID, it was tended to be a very mild case. Didn't tend to, but yet we're giving vaccinations, and we had some of the vaccinations were taken off of the market because there was blood clot issues. But what's your thinking now on whether young children should be vaccinated for COVID? And what's the latest science? What's the latest recommendations?
Well, the COVID vaccine for patients, for children, parents' choices. So nobody made children get vaccinated. And if this happens again, you would look at the risk and the benefit. The benefit that you're not discussing about having children vaccinated is they didn't infect their grandparents. They didn't infect as many school kids.
But did the vaccination prevent the spread? I mean, that's another scientific fact we don't know for sure.
I think that we do know that helpful vaccinations help decrease the spread.
Well, it was helpful, but we had a lot of cases where you got vaccinated, but you still got COVID.
Right. Just the same as a flu shot.
Right.
There's not a guarantee, and every year sometimes the flu shot's more effective than others. We don't know till the strain gets here. But we do know if you're vaccinated, it does decrease the length of your illness and the severity of your illness.
Okay, changing the topic. What is your thinking on the current Health and Human Services Director, Mr. Kennedy, his suggestions that we change some of the dietary standards for children and getting the dyes and out of the and food colorings out of the food, some that have been shown to be carcinogenic. What's your thinking on some of those directions that are being taken?
Okay, so again, my opinion as a medical practice, but not in my health department role, is I have no issue with getting rid of red dye. I don't think it's necessary.
And of course, with the county, we follow whatever the
right. That's why
what the
my opinion
science
doesn't
is.
matter.
But I read a lot of the science on this. It looks very clear. In Europe, they've done this for years, and we're way behind. So it looks like we're headed the right direction on that, to me at least. Federal Title X regulations on Title X clinic that it excludes provision for counseling or referral for abortion. Are you supportive of our current policy?
Well, again, my opinion doesn't matter. I have to follow the state statutes. So Federal 10 is a federal program. I'm not in charge of that, nor do I. KU does that. I'm not involved in that. I have to take the competency test on that to be the medical director, but I don't have any control or say.
I know. Do you support the policy?
I don't know that is. You're asking me my opinion, and I don't know how that. I don't know how that is valid. I'm not. My opinion doesn't matter.
You're our medical director representing us. So
right, but I can't
change. What your opinion is.
I can't change Title X, and I'm not in my role as the medical director, not in charge of that.
I realize that. I just wanted to know if you were supportive of the policy or not.
Could I jump in here for a second, please?
Yes.
Ma'am, you are regulated by CDC's regulations. Is that correct?
And the Kansas Health Department, yes.
Okay, so your personal opinion really doesn't matter.
Especially with the federal grant Title X, I don't have any role in that.
Exactly. Okay.
That's what I'm trying to say.
Okay, so whether children are masked at a certain age is not you have nothing to do with that. That comes from CDC, is that correct?
That's correct.
Okay, so you're mandated by those regulations.
Correct.
Okay, and so far you're going through that and making sure that we, as a county, comply.
Correct.
Is that correct?
Correct. That's my role, yes.
That is your role. So again, I'll say, so your opinion really doesn't matter in this situation. Is that correct?
That's what I'm trying to say. Yes, you may have said it better, but yes.
Okay. I understand Commissioner Stevens' questions. However, I think that we should be centered in on what is required by CDC until former Senator Kennedy changes some of those things. Or understand that there's a new director for, I'm trying to think of the name of the individual, famous doctor that has taken over as far as Medicare. So,
Oz?
yes, Paz.
Oz?
Yeah, Cause rather. Thank you very much.
So I realize that in the application of the rules, we have to follow the Title 10 guidelines, and you don't have any control over that.
Correct.
So set that aside. I'm asking you if you personally support that policy
Right, and I'm
as
not,
an individual.
right, and I'm not going
Mike, I don't think she has to. I mean, if she wants to, you can say, like on his old cop, you feed the fish. You don't have to answer if you don't want to. I mean, it's a question that's coming at you. You're not here being subpoenaed.
Excuse me, Commissioner, for you to say she doesn't have to answer that?
Her opinion.
I'm asking her opinion.
But she doesn't have to answer the
You don't have to
opinion.
tell her she doesn't have to answer her opinion. Well, the opinion buttresses whether the person in your position, we hope, will follow the philosophies that the commissioners have. So therefore, the reason I would ask you for your opinion would be to know what your philosophy is.
Right, but it's not valid because it really, honestly, your opinions also don't matter for Title 10 because we have to follow the federal guidelines. You can all have an opinion that's different than the federal government, but we still have to follow what the federal government says.
Well, that's said. That's stipulated. We are going to follow the rules.
Right, but you just asked me if I was...
I'm asking you as the medical director, do you agree with that policy?
Right, I'm not going to answer that.
And I have an issue with that because I think we want our medical director to agree with our philosophy that we don't do counseling or referral for abortion, and you should agree with that and be willing to say that.
I'm not going to comment on that. I once again, it's your opinion, and your
It
opinion.
is my opinion, and
Correct, and that's fine.
I think she's made it very clear she's not going to. So let's move on to the next one. Yeah, what else you got, Mike?
Minors under Title 10 are talking about abortion. Take that off. We had an issue with Title 10 and minors being brought in by school nurses or various people to the health department that are not required to get parental notification for distribution of contraceptives or being given Depo-Provera or whatever it is. What is your philosophy on that? What is your thinking on that?
Once again, I'm following the guidelines from the Kansas Department of Health and the federal guidelines. Kansas allows minors in certain instances to get contraception, and we're following the law.
Would you be able to expound on that some?
Like, you mean what are the...
I think you said in some instances.
Right, if they're emancipated, there's age limits, but...
How young can a person be?
To be emancipated, if somebody's... If somebody is sexually active, that allows them to have the right for birth control in the state of Kansas.
So what would you think the youngest person is that?
The youngest I've delivered is 12.
Okay.
She was not 12 when she got pregnant.
Right. Thank you.
So what we're talking about, though, is not a rule for the state of Kansas that we have to do that as a county. But the rule is that we're going to receive Title 10 funding and we're going to be participating in that program, then we have to provide contraceptives without telling the parents in certain cases.
Correct.
That does not say that we have to take that grant funding because Miami County doesn't participate in the program because they don't agree with that philosophy.
Correct.
So the bottom line on this is I wanted to know whether you agree or disagree or what your thoughts are on minors and parents and what the involvement should be and what your general philosophy is on this.
Well, I'm following the state.
You're not going to give us your personal philosophy at all.
No, because it's not important for this meeting, in my opinion.
Well, to answer that, I just am following the regulations and to not let us know what your personal thoughts are, wouldn't you think that that's a little disingenuous?
No.
Well, I think.
I'm supposed to treat everybody.
I'm
supposed to treat everybody equal. So
it'd certainly be nice to know what the medical director's thinking was on giving contraceptives to minors without letting the parents know. It'd certainly be good for the commissioners to know what the medical director's thoughts are on whether counseling or referral for abortion should be offered at the health department. But you're saying you're just going to follow, you're going to hide behind the regulation and not tell us what your philosophy is.
I'm not hiding. I am
You're
following.
not telling us.
I'm following the guidelines.
But we don't know what you think.
Yeah, that's
Like,
correct.
I think she's made it clear she's not going to answer that. So
I can tell that.
So let's move on.
Okay.
Anything
Just
else,
to be
Mike?
clear, Commissioner Steve, abortions cannot be completed at the health department, nor will they ever be completed at the health department. That is not, we are not.
And I understand
an abortion clinic.
but that's a Title X regulation as well. But Title X doesn't allow abortion counseling or referrals. But on the contraceptive issue, it's a little different.
Correct.
So I just wanted to know, I was hoping to be assured that you agree with those things.
Do we give like the morning after pill, things like that?
Those medicines are over the counter.
So we just refer them to a local store for those,
I'd
or
like to bring
Sarah.
clinical manager.
Sarah.
She runs the title program and can speak on a lot. I think maybe a lot of those questions that you.
Yeah.
Okay.
Yeah.
If you don't mind, I just wanted to go back a little
Could
bit.
you-
So sorry
could you-
I didn't prepare this for.
Pardon me, before you start, could you give us your name and where you're from so we'll have it on record?
Okay. My name is Sarah Beaudry. So I'm the clinical manager of the health department. And you want to say I live in Leavenworth or?
No.
No, go ahead.
No pledge.
Have at it now.
Okay, I pulled some data just really quickly in preparation for this, and so I did a chart of age ranges of services that we provide under Title X. So the majority of the people that we serve are 18 to 39, and about 11% of the patients were under 18 last year in 2024. Using our EMR system, I was able to pull numbers going back until 2009, and overall, our under 18 clients were 9.6%. As far as those who did not have parental permission when they came in, again, our system is antiquated, which is why we had the meeting earlier. I went through all those records to see who said that a parent, either they were present or that they knew that they were there, and it was less than 10% of the people who had come in. So with that, any minor who comes into the health department will have a conversation about all of this. We're not about just handing out birth control to you're 13, sure, here we go. No.
And don't the Title X regulations actually have a requirement that you seek parental involvement, that you try to get
Yes.
parental involvement?
We recommend, if they don't have a parent or a trusted guardian with them, we counsel them about how to have conversations to involve their parents. What is the circumstances of why your parent doesn't know, or and sometimes that counseling is ways to bring the subject up with their parents. sometimes kids just don't know how to say that. And, we offer them, they can come to the health department and bring their parent, and we can help them with those conversations. We also provide education because a lot of these kids are not getting this information from other places, and we provide factual, medical, evidence-based information to them. So, and then Commissioner Reed, going back to your question about the Plan B pill, we provide it to established patients. So they have to have come in and had an appointment with one of our physicians from KU. So they've already done the medical screening, and we would know if it was appropriate for them to get it. Again, this medication is available over the counter, but when somebody comes in to get from us, we have a counseling with them. We talk with them about if it is appropriate to use at that time. I mean, there's a very narrow time window in which it can be used. And so, there is a lot of discussion with counseling and education that happens when people come into the health department. And so if a minor can go into Walmart and buy condoms, and they're not going to have any conversation with an adult. No one's going to tell them anything.
But condoms isn't typically what, I mean, I had to pull the records, and we had the 23 cases, and it was like 2 were condoms. The rest were some kind of a chemical.
So I've heard some conversation about trying to reverse different types of abortive measures. Does the health department also do anything like that? Okay.
No, we are not involved in abortions at all. We occasionally may have someone who has come in afterwards who's having issues, but typically we refer them to other care because we're not an emergent facility. So that's kind of out of our
I think
scope.
what she's referring to is the abortion pill reversal.
Right.
And I think the Sparrow clinics have at least a couple cases where there's babies now. They took the first pill, but they just changed their mind, and then they helped them through to get hormones, treatment, and they were able to deliver.
So the scientific evidence has not shown a significant difference between a person who just doesn't take the second dose versus the ones who take this reversal medication. So we don't offer it. It is not something that is evidence-based practice.
Is that scientific from the CDC? Is that what you're talking about?
It's from different randomized controlled studies.
American College of OB/GYN.
Yes, and the American College of Obstetricians and Gynecologists, so ACOG, which is one of the leading professional bodies that gives the recommendations for.
Of course, the state of Kansas passed a statute that allows for that abortion pill reversal.
And
it's currently in law.
I'm not aware of that law. And if it's, I mean, if it's available, that's.
Well, I know that they've done this at the Sparrow Clinic, but it's okay. Let's go back to Title 10. If Title 10 regulations change, President Trump could change these regulations at any time. This is why I haven't gone after Title 10, because I think I support most of what Title 10 does. But if those regulations change on the parental notification part, then our whole regulatory will follow those regulations.
So do you guys refer to, who do you refer people to who are either wanting to talk about having an abortion, or what are the references that you provide for them?
It's very independent.
Okay.
It's if somebody straight up asks where to go.
Yeah.
Typically Planned Parenthood.
Okay.
I think there's only 2.
But we
We
don't
don't.
go down that road. We follow the guidelines. That's not something we try to find other resources. Whether it is Sparrow Clinic, we work with Sparrow Clinic. We work with all of We just have to follow the guidelines in regards to what programs we have at the health department.
That's what I was asking, if you give fair representation to like Planned Parenthood and Sparrow Clinic, or if you kind of...
If someone is not knowing, we have a social worker that runs pregnancy programs, pregnancy case management. Our role is to provide non-directive counseling and education. So most of the time people who are coming and they take a pregnancy test, they know they've taken one at home and they need a confirmation to start Medicaid or something like that. And we refer them to our social worker. Hey, she has some great programs that can support you during your pregnancy, very similar to Sparrow Clinic. She provides a lot of education, and it's personalized case management. So if you have someone who is, needing support with housing, she provides resources to assist with that. If they need help with their utilities, if they need help with childcare, if they are a teenager, she gives them support to help them continue their education. And if they don't want to stay in school, she provides opportunities to help them get their GED. So it is, a tailored pregnancy case management. So we provide those services. When it comes to the conversation, only when someone specifically asks us, for that information, we'll provide it. But it's not something that is very frequent. So
Thanks so much.
I think that, and I'm speaking for one commissioner, but I think that my bottom line is, and I ran on this platform, I don't agree that abortion should be a method of birth control in Kansas.
And it is not. That is not one of the methods that
and that's why I'm asking the questions. I hope we're okay with us asking some hard questions, because it's very uncomfortable when our state is moving. We have this great tourism industry now in Kansas. Our abortion rate's gone up 4,000% because of all the people coming in from out of state, and that's disappointing. And I want people to be able to make good choices. I want teenagers to be given good information, and I want families to be as involved as possible. I know there's exceptional cases. There's always exceptional cases.
The bottom line for us, Commissioner, at the Health Department, that's, again, not a resource that we provide, not something that we give out, but we give out factual information. If somebody were to come and ask, we will tell them about it, but we do not refer them to it. We don't get them there. We don't set up transportation. That's not anything that we are involved with.
And that's my understanding. It has been since 2019. That's been my understanding. But when we're here, we don't get to speak to the health director that often. We want to know, and the reason I'm concerned that you don't answer my questions is because I want to know that you agree with that. I want to know that you basically agree with that philosophy, that you're not going to tell us.
No, because once again, my opinion doesn't matter. I don't do abortions. I've never done an abortion. I don't think anybody in Leavenworth County does.
But if the commissioners want to have a health director that represents their philosophy, and we're asking our health director, what is your philosophy, and you won't answer our question, that really is concerning.
Mike,
I'm sorry.
Mike, we understand where you're coming from. We beat this up pretty bad. Okay, anything else for the folks? Did you have something else you'd like to say?
I was just going to say, we can look at the numbers across the state of Kansas for abortion rates, but looking at the rates in Leavenworth County from the past 4 years and then for the past 12 years, it's been the same. It's been about 10%. We haven't seen an increase within the county. And again, I just want to reiterate that Title 10 does not, abortion's not a method of birth control, but the program, one of our goals is to not get to that point, whether it is providing contraception or providing education that makes people think twice and abstain. That is our focus. But
a good two-parent family where everybody loves each other is the best thing for helping prevent all kinds of social problems.
And not everybody has that, unfortunately.
That's right.
And
I don't have that.
Thank you guys
Okay,
so much.
I think we're doing good. Thank you for
Thank
coming
you.
down. Appreciate it. Okay, Danny? Danny, did you have something? No, I'm good. Okay, just hadn't seen you in a while. Just checking on you, man. Okay. Oh, no, I think that goes both ways, guys. Okay.
I do appreciate that she went over those abortion rates for Leavenworth County.
Yeah, that makes sense.
Because we
hear
hear
different
that
numbers on media, though.
we hear that
Yeah, we
the
do.
state of Kansas
Yeah.
is like a destination now, and
I've heard that
so
on social media.
being so close to the border, I think it's nice to hear about that. Must be
That was
coming
a
from
good
other
one.
Check
directions.
the statistic. I would recommend call Kansas for Life. They have a lot of good statistics on this.
Okay, Jeff, you want to take us into executive?
Sure. I moved that this board recess for closed executive session to consult with our attorneys and discuss confidential matters related to potential claims and litigation which would be deemed privileged in the attorney relationship as permitted under COMA, and that the board resume the meeting at, what do you need, 15 minutes?
It was 15 or 20, Mark? 20?
15's good.
15.
He's good.
11:55.
Good, close enough. Got a second?
President of the meeting will be Commissioners Culberson, Reed, Dove, Stephen, County Councilor Lothry, County Councilor Misty Brown, and Deputy County Councilor John Khalil.
Second.
What's his name? Mr. Stephen?
Aye.
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 All right. All righty.
The board has returned to regular session at 11:55 a.m. No action was taken. No decisions were made. The subject was limited to the legal interests of the county.
Very good. Thank you, Commissioner. We'll start around, Mike's not here, so any other things? Just a reminder, the Lansing meeting tomorrow at 6. Is that correct, Mark?
Yes.
Okay. And we have an agenda with some things that we'll discuss, but yeah, over at Lansing City Hall. Glad I brought that up, Willie. Mr. Dove, you have anything?
No, I do not.
Vanessa?
I do think read one page from a magazine, several pages long. I appreciate it. Inside the Empire for F. Rufo, the trans movement is pressing its agenda everywhere. Most publicly, activists are using classrooms to propagate on its behalf, and health professionals are promoting the mutilation of children under the euphemistic banner of gender-affirming. The sudden and rise of this movement provokes questions. Where did it come from, and how has it been so successful? The story goes deeper than most Americans. In the late 1980s, a group of academics, including Butler, Gil Rubin, Andy Stone, and Susan Stryker, established the discipline of queer theory and transgender studies. These academics believed gender to be a social construct used to oppress racial and sexual minorities, and they denounced the traditional category of man and woman as a false binary that was conceived as a system of heteronormativity, i.e., the white heterosexual power structure. The system, they argued, had to be ruthlessly deconstructed, and the best way to achieve this, they argued, was to promote genderism. If men became women and women men, they believed, the natural structure of creation could be toppled. Susan Stryker, a male to transgender professor currently at the University of Arizona, revealed the thrust and tone of transgender ideology in his Kessler Award lecture at the City University of in 2008, describing his work as a secular sermon that unabashedly advocates using a disruptive and refigured genderqueer or transgender. Sorry, give me just 1 second. I lost my.
We got you.
As a spiritual resource for social and environmental transformation. In Stryker's best-known essay, My Words to Victor Frankenstein, above the village of Chamonix, forming transgender rage, he contends that the transsexual body is a biological construction that represents a war against Western civilization. I am a transsexual and therefore a monster, Stryker writes. And this monster, he continues, is to channel its rage and revenge against the naturalized heterosexual order, against traditional family values, and against the oppression of nature. It is clear from this and other transgender that the transgender movement is inherently political. Its reconstruction of personal identity is meant to advance a collective political reconstruction or transformation. Trans activists see their movement as the future of racism. In a collection of essays titled Transgender Racism, activist writer Rosa Lee argues that trans can serve as the new vanguard of the proletariat, promising to abolish heteronormativity in the same way that orthodox Marxism promised to abolish racism. In a different way, Lee writes, Marx spoke of the construction of a new socialist man as a crucial task in the broader process of social construction. Today, in a time of both rising fascism and an socialist movement, our challenge is transitioning our Marxism. Think of the project of transition to communism in our time. Communization, including the transition to new communist norms, new ways of being and relating to one another. This is the great project of the transgender movement, to abolish the distinctions of man and woman, to transcend the limitations established by God in nature, and to connect the personal struggle of trans individuals to the struggle to transform society in a radical way.
Thank you, Vanessa. Hey, before we go, Jeff, congratulations, first time grandpa. Thank you. Mark. If you have anything?
Nope.
Entertain a motion to adjourn.